In this video, we're going to be looking at the arteries and one of the veins that we can see in the abdominal area. So in here, we're in the abdominal cavity, this big structure, that's the abdominal aorta. We had looked at it from behind, but looking at it from the front, kind of starting through there, as it goes down is when it's referred to as the abdominal aorta. It's going to split. At that point, it's called the iliac arteries. So we'll look at that when we look at the limbs. And so looking at all these branches that are coming off the abdominal aorta. So starting off, the first one is right underneath the liver. I'm gonna kind of back it up so you can see where we're at. And then as we zoom in, this trunk that's right here, this artery piece, I might try coming from a slightly different angle so you can see it from there. This is referred to as the celiac trunk. Again, always look to where like splits are, because a lot of times when something splits, it's called something else. So the first thing to branch off the abdominal aorta is the celiac trunk. And then from there, we're going to have two pretty big arteries branching off of there. So we have this one going to the left side that's traveling to the spleen. This is called the splenic artery, this big artery here. The one going to the right, going to the liver, is the hepatic artery. So kind of following that along. All of that is the hepatic artery, in red. It's going to split going to the different lobes of your liver. There's a blue one running with it. This one isn't the hepatic vein, it's called the hepatic portal vein. And that's bringing the blood that's coming from your intestines before it goes into the circulatory system. It's going to go through your liver first, where your liver cells are going to process that. And then the hepatic veins are going to return it back to the inferior vena cava. So as it comes from the intestines into the liver, this blue one here, try to get a good angle here, is the hepatic portal vein. Through there and then tucked underneath there. So the blue one is hepatic portal vein, red one is the hepatic artery. So the liver actually has two blood supplies. Hepatic artery brings oxygen-rich blood. Hepatic vein brings oxygen-poor but very nutrient-rich blood. Okay, the other one to associate with celiac trunk is going to be this tiny little wire here. This is representing the gastric artery. Okay, this is going around the inside curve of the stomach. So the stomach doesn't fit inside here. There's actually another artery here that comes around and connects. You don't have to know it for the practical, but imagine the stomach is sitting like in here. Okay, so this is the gastric artery, that tiny little wire. So with celiac trunk, you're going to think of, you have splenic artery, hepatic artery, and then the gastric artery. The next thing to come off the abdominal aorta is going to be this pretty large branch here called superior mesenteric artery. The mesenteries is what holds your intestines together. And so these arteries are branching through the mesentery. The models don't show all the branches that are happening. So you want to check visible body or look at some pictures for that. This is sending blood vessels to all the different parts of your intestines. So we have superior mesenteric artery. And actually, if you follow it along, you'll kind of notice this loop here that connects to another large structure. It's called the inferior mesenteric artery. So superior is up here. Inferior is down here. Inferior is the last artery to branch off the abdominal aorta before it splits. So think of that's the inferior mesenteric artery. And so in between there, we had a couple. So going to the kidneys, we got the renal arteries. You're going to have one on either side because you have two kidneys. In red are the arteries. Veins are going to be renal vein, but you just have to identify renal artery. And then there are these teeny tiny ones. Move this out of the way. These are representing are called the gonadal arteries. So this tiny little wire that's coming off the abdominal aorta there. You got red and a blue one. These are going to the gonads. So the more specific term in females would be the ovarian arteries going to the ovaries. Males would be the testicular arteries going to the testes. So that's this tiny little wire here. Okay, so it looks a little complicated, but just follow going to the organs that it's traveling to, and that's what's going to be the name for all of these arteries in this abdominal area.